Hi guys, so I'm making this video as an update to my original COVID-19 video on March 10th. If you haven't seen it, please go back and watch. Lots of information in there. All of that still applies today. So the point of this video is to do it from a healthcare point of view, from our doctors on the front lines. And so I hope that this gives you a perspective as to why we are worried and why you should follow our recommendations. As of today, the town of Richmond Hill, where my parents live, has declared a state of local emergency as the number of cases rise. The threat is real, the enemy is armed, and very, very dangerous. So what's happening on the front lines? Hospitals are opting to cancel non-urgent surgeries, non-urgent specialist appointments, and non-urgent imaging studies are being postponed. Everyone has moved to telemedicine, phone and video appointments, even in my own clinic. We have a big stop sign on the front door to stop people from entering, and we are asking that everybody call our office first. Many healthcare workers are in isolation. We are losing our man and women power. Many healthcare workers are awaiting COVID-19 testing results, but the turnaround time for the test is 5 days. Labs are very overwhelmed. Only a certain number of tests can be processed on any given day. Telehealth Ontario is overwhelmed. Public health departments are overwhelmed. They're fielding calls from right, left, and center. Everybody is calling them. Long wait times if you call, and you may have to call several times to get through to actually speak to someone. If you do have your own family doctor, I would suggest that you try their office first to get advice. We have designated COVID-19 testing centers apart from the emergency department to separate out potential COVID cases from non-COVID emergencies. This is to reduce the foot traffic. At South Lake, the assessments are being done outdoors. A doctor and nurse are going up to your vehicle, talking to you, and if you need to be tested, likely testing you while you're still in your vehicle. There is a shortage of personal protective equipment for frontline staff. We don't have an unlimited supply of masks, gloves, shields, gowns for medical staff to protect themselves and to treat others in a safe way. Even one doctor becoming infected is a huge problem. On average, a doctor can see between 15 and 30 patients in a day. Imagine if that one doctor didn't have the appropriate protective equipment, went on to infect all of those other people, and they probably didn't have symptoms, as the incubation period, as I will remind you, is 14 days, which means you could potentially have no symptoms for almost a week and be infecting others. We wouldn't send our firefighters out to fight a raging fire without their appropriate gear. We should not send our healthcare workers out to fight this war without their gear. Frontline workers are extremely stressed out and worried, and with good reason. They have a high chance of getting sick. They have families and loved ones. They likely have people around them that are vulnerable, and they are witnessing the virus spread like wildfire without having any effective cure or treatment. And we as doctors are trained to help, cure, and treat people. And if we feel helpless or hopeless and can't do that, that has a significant psychological impact on us. If someone gets sick with the disease, they can be unwell for 1 to 4 weeks. If 10% of our healthcare workers are sick, like was estimated in other countries, then we have a huge problem. Our governing bodies have made it easier for community doctors to get hospital privileges because we anticipate that we are going to need them in the hospital. We are asking retired physicians to consider reactivating their license for this reason. Our guidelines for testing are changing continuously. At the moment, there's community spread. So travel history is becoming less relevant. We are no longer focusing on just travelers, but we are actually seeing a lot of local transmission. We are focusing on testing those that will likely become ill and need hospitalization, those that have serious symptoms like difficulty breathing, high fever, inability to maintain their oxygen saturation, are becoming lethargic and fatigued from coughing, or they have an underlying medical condition that puts them at risk of having complications or a very serious course of the disease, or they're over 65 years old, or they are part of a vulnerable population, like being a healthcare worker, or living in a group home or shelter where they could potentially infect many other people. Only about 50% of the cases that present to the emergency department are getting testing. The rest, who have mild symptoms, are being told to go home and self-isolate and manage their symptoms at home. This is likely leading to an underestimate of the actual number of cases. The virus is a sneaky little thing. It is presenting in different ways, some with stomach upset, some with sore throat, and not necessarily always with the typical cough, fever, and shortness of breath. There are likely many factors that are playing into why some get really sick and some do not. Part of it is obviously your own immune system. Part of it might be related to what viral strain you get, what viral load you acquire. And part of it we don't even understand just yet. So yes, it is true. Most cases are mild. Most will recover. Having the disease per se isn't the problem, because those that are actually really sick aren't infecting other people. They're probably already isolated because they're too sick to go out. The problem lies in that many have no symptoms and feel well and feel like they are fine and unknowingly spread it to those who cannot fight it. The virus can shed even after one thinks they are perfectly fine and have recovered. So guidelines are suggesting that people with COVID-19 remain in isolation for at least a minimum of 2 days after they have absolutely no symptoms. On average, a person can infect between 1 and 4 people. If one person infects 4 people and those 4 go on to infect 4 more, you can see where this is going. It could be catastrophic. If we all get sick at the same time, we are in big trouble. There are only 2.5 hospital beds per 1,000 Canadians. We will be at capacity. We will have to turn people away. We will have to play God if we don't get our act together and if we don't act to reduce the spread. So let's be the smart people that I know we are. I have faith in society, humanity, and I certainly have faith in Canadians. I'm not saying that social distancing is actually what needs to happen. I think at this point, social isolation is what needs to happen. Heck, everyone needs to act like they are infected and they are a threat to their parents and to their loved ones and to the elderly and to those fragile people in our society. If we act like we could potentially do significant harm just by going out to grab a coffee, then hopefully we will rethink that decision. The goal of shutting down is to flatten the curve, which means reducing the spike in the number of people sick at one particular time, so that we can spread out the number of people sick across a bigger period of time, so that those that do get sick, we can actually treat and get better. So guys, if I'm scaring you, I've done my job. Please take this seriously. I know it's hard to comprehend all of this information. It's hard to imagine. It's kind of like it's out of a sci-fi movie, but this is what's happening. A small little viral particle that needs our body to actually survive and thrive can infect and hijack our cells and wreak havoc. This is what is happening all around you. So if you found this helpful, please spread the word, not COVID-19. Share, share, share.